Have you ever wondered where that line is? The one between just normal, everyday stress and something more? Well, today, we're going to break down the official Dutch General Practitioner's Guideline on Anxiety. So let's dive in and really unpack how doctors figure out this complex world of worry, from the very first signs all the way to a clear path for getting better.
And that really is the big question, isn't it? What is the actual line between the worry we all feel and a clinical disorder? It's a question so many of us have, and the answer, as you're about to see, is definitely not a simple yes or no.
Okay, so first things first, let's get the fundamentals right. We have to understand the huge difference between anxiety as a totally normal human feeling and anxiety as a clinical disorder.
To really get what goes wrong, you first have to appreciate what goes right. The guideline takes us right back to biology, making it super clear that anxiety itself isn't a bad thing, not at all. It's a normal, protective response that's hardwired into all of us. When you're facing a real threat, your body gets you ready to either fight or run. That racing heart, breathing faster, that's just your survival instinct kicking into high gear. It's anxiety doing its job.
This is where the difference really matters. See, normal anxiety is a response that fits the situation. But the guideline defines abnormal anxiety as a reaction that is way more intense, lasts a lot longer, and is often set off by something tiny, or sometimes nothing at all. The key thing here isn't the feeling itself, it's the context. When that feeling starts messing with your daily life, that's when you know it's crossed the line.
So that makes you wonder, where exactly is that line? The guideline is really clear. There's no sharp black and white cutoff. It's more of a spectrum. Figuring out where normal worry stops and a disorder starts is a team effort. It's a conversation between you, the people who know you best, and of course, your doctor.
And that brings us to the next step, diagnosis. So once someone decides, okay, I need to get some help, what actually happens in the doctor's office? How do they start to piece this whole puzzle together?
It's pretty rare for someone to just walk in and say, hey, I think I have an anxiety disorder. It's usually way more subtle. The guideline points out these signals for doctors to look for. Things like coming in frequently for different issues, physical symptoms like dizziness or a racing heart that don't have a clear medical cause, or asking for sleeping pills again and again. These are often the first clues that something deeper is going on.
To get the complete picture, often use structured tools like what's called the SCGE-S model. Now, this isn't just a simple checklist. It's a way to have a conversation that covers 5 key areas: somatic, how your body feels; cognitive, what your thoughts are like; emotional, the feelings you're having; behavioral, the things you're doing or not doing; and social, how it's affecting your relationships. It's a holistic way to make sure the diagnosis is about the whole person, not just one symptom.
So, once the doctor has that clear picture, the next step is often to give the experience a name. And this isn't about slapping on a label. It's about identifying a specific pattern so you can find the most effective way to treat it.
The guideline lays out several different anxiety disorders, and each one has its own path and its own best treatment. You've got panic disorder, which is about those sudden, intense rushes of fear. There's agoraphobia, the fear of situations you can't easily escape; social phobia; generalized anxiety disorder, or GAD, which is that constant, persistent worry. And then there's obsessive-compulsive disorder, or OCD.
What's really interesting is that the data shows a pretty surprising pattern for when these disorders tend to show up. A specific phobia, that often starts in childhood, around age 8. Social phobia tends to pop up in the teenage years, hitting around 17. But then look at panic disorder. That shows up much later, around 33. And generalized anxiety disorder, even later, at 40. It just goes to show you that these things can appear at very different stages of our lives.
So, just how common are we talking?
Well, the numbers are pretty big. According to the data in the guideline, in any given year, about 12.5% of women and 7.7% of men will deal with an anxiety disorder. This isn't some rare thing, it's a major public health issue that affects millions of people.
All right, this brings us to what I think is the most important part of this whole thing, the path forward. The guideline lays out a super clear, evidence-based, and really hopeful plan for getting better. It's called the stepped care model.
The whole idea is pretty simple. You start with the least intense, most empowering options first. So, step 1 is all about education and monitoring. Sometimes just understanding what's going on can make a world of difference. If that's not enough, you move to step 2, guided self-help. This could be things like online programs or workbooks that give you tools to manage your symptoms, with a little bit of professional guidance. And only if those steps aren't enough, or if things are more severe, do you move on to step 3, which gets into more intensive options like formal therapy or medication.
And this really gets to the heart of modern treatment. It's not one size fits all. The guideline makes it so clear that the final decision is a shared one. The right path for you depends on your specific diagnosis, how bad the symptoms are, how much it's impacting your life, and, this is so important, what you prefer as the patient.
Okay, so let's zoom in a little bit on step 3. When formal therapy or medication is the right move, what do those options actually look like?
One of the most effective therapies out there is cognitive behavioral therapy, or CBT. The whole point of CBT is to help you break that vicious cycle of anxiety. It works on 2 levels. The cognitive part helps you spot and challenge the unhelpful thoughts that are fueling the anxiety, and the behavioral part helps you gradually face the situations you're afraid of. It's all about learning real, practical skills to get a handle on the anxiety yourself.
Now, when medication is part of the plan, doctors have a few choices. The 2 main types of antidepressants they use are SSRIs and an older type called TCAs. As you can see here, SSRIs are usually the first choice. And why is that? Well, they tend to have fewer difficult side effects, and they're just simpler to dose. But of course, a doctor is going to look at a patient's whole health picture, things like heart conditions or other meds, to pick the absolute safest and best option for them.
And here is something the guideline is really clear about, a critical safety point. You should never, ever just stop taking an antidepressant cold turkey. To avoid really unpleasant withdrawal symptoms, the medication has to be reduced slowly, bit by bit, and always with a doctor guiding you. It's the only way to ensure a safe and smooth transition off the medication.
So we've walked through the whole clinical guide, from what anxiety is to how it's diagnosed and treated, but it kind of leaves us with a bigger question, doesn't it? If the ability to feel anxiety is a normal, hardwired part of being human, what does that say about the world we're all living in? And maybe, how can we start to think about building environments, at work, in our schools, in our communities, that actually support our well-being? And maybe trigger that fight or flight response a little less often.